Hi, I'm Diane Womack-Walters. I'm a licensed clinical social worker. I've been in the business for close to 35 years. I have a specialty in addictions, but can see just about anybody with depression, anxiety disorder, post-traumatic stress. The different types of addictions are like different flavors of the problem, but the problem is basically the same. It's addiction. It's a disease process of the neurotransmitters in the brain, and it should be looked at that it is a disease and not a fault or somebody's, should be shamed because they have it. It's just like if you had a heart attack, you would go to the hospital, you would go to rehab afterwards. It's the same thing with addiction, depending on where you're at in that disease process. You would go to different places. Like you could go here to see me for an hour once a week if you're in the beginning stages. If you're in the later stages, you would go to rehab because it's a more critical place in that disease process. The specialty in addiction has been one because in my family, both my parents were what we would call functional alcoholics, and I didn't realize that until after I got out of it, married an alcoholic. Why did this happen? And then I got to looking at my family history, and the whole tree's full of them, but you don't realize that when you grow up in those family systems. So that's why I went into that specialty, because my children are growing up, or are grown now, and I wanted to know as much as I could about it so that I could be educated in case they would have a problem.